Hello everyone, welcome to my channel. So today in this video we are going to discuss about a very important topic in anatomy, that is the mammary gland. So mammary gland, we are going to discuss this mammary gland in 8 subtopics. So let's start. Uh, as we all know, the mammary gland is a modified sweat gland, and as you know, that is rudimentary in males and it is well developed in females. Okay. So, first thing we are going to discuss about mammary gland is the situation of this gland. So, mammary gland is situated in the pectoral region and in the superficial fascia of the pectoral region. So, it is situated on the pectoral fascia. Okay. And second thing we are going to discuss is the extent of this mammary gland. So, horizontally, it is extended from the lateral border of the sternum to the mid axillary line. Okay, but vertically it is extended from the second rib to the sixth rib. Okay, so these are its horizontal and vertical extent of the mammary gland. Third, we are going to discuss is the deep relations of the mammary gland. So this is the mammary gland. If we remove the mammary gland, so we will find some space, and that is known as the retromammary space, right? The space you are seeing here, this is the retromammary space. And after the retromammary space, we can see this is the pectoral fascia. And pectoral fascia is covering the pectoralis major muscle. And actually, we can see three muscle over the mammary gland. That is, one is the pectoralis major, serratus anterior, the lower four slits of serratus anterior, which is interdigitating with the external oblique abdominis muscle, right? So these are the three muscle located deep to the mammary gland, right? So we will find first of all this retromammary space, then we will find this pectoral fascia, and then we will see these three muscles. So these are the deep relations of the gland. Now we are going to discuss about the structure of the mammary gland, right? So actually the gland is divided into three parts: the skin, parenchyma, and it is studied in these three parts: skin, parenchyma, and the stroma. Okay, let's talk some points in the skin. So as we know, the mammary gland is a modified sweat gland. So its skin is having too much sebaceous gland and the sweat glands, and uh, we can see a midline elevation in the mammary gland, in the both mammary gland, and that is known as the nipple. So the nipple is situated 10 centimeter from the midline in the fourth intercostal space. So this location of the nipple is very important. It is also important in surface marking also. So and nipple has two kind of muscles, circular and longitudinal. Circular to make the nipple stiff and longitudinal to make it flatten. Then we can see some right. See, this is the nipple. Okay, so around the nipple we can see some elevated ridges, or we can see elevated skin around the nipple. That is known as areola. And when a mother is lactating, right? During lactation, we can see some elevated skins, elevated tubercles like structure around the nipple, and that is known as tubercles of Montgomery. Okay, mammary gland is a compound tubular alveolar gland, and we have so this is about the parenchyma of the gland. In the parenchyma of gland, we can also see this kind of 10 to 15 lobes in the gland. So in each mammary gland, there are 10 to 15 lobes. With then they are forming the lactiniferous sinus. This lactiniferous sinus are then forming a lactiniferal tubule, and which is opening near the opening of the nipple, right? So baby can suck the milk from this lactiniferous ducts. Okay, so this was about the parenchyma of the gland, and this dilatation is known as lactiniferous sinus. Okay, so this is about the parenchyma of the gland or glandular part of the gland. Second thing we have is the stroma of the gland. Stroma is the fibrofatty tissue situated around the gland. Okay, so what we can see in the stroma is this is the first. It's the first thing, that is the ligament of Cooper. So ligament of Cooper actually anchor the skin and gland to the pectoral fascia. You can see they are adherent to the skin and also to the pectoral fascia. So they are anchoring the skin to the pectoral fascia. Okay, so this is the part of uh, stroma, that is the fibrofatty tissue, and we can as I mentioned earlier, we can see some space behind the pectoral between the pectoral fascia and the gland. This space is known as retromammary space. Okay, and for study purpose, the mammary gland is actually divided into four quadrants: the upper medial, lower medial, upper lateral, and lower lateral. Attachment of a skin-like thing near the upper lateral quadrant. So this This attachment is actually known as axillary tail of spans. Axillary tail of spans. And this axillary tail of spans is passing through this foramen known as foramen of Langer. So axillary tail of spans is passing from the foramen of Langer. Okay. So this was about the situation, extent, deep relations, and the structure of the mammary gland. The mammary gland is actually supplied by some arteries. Okay, there are main three arteries we can see is the axillary artery, internal thoracic artery, and the posterior intercostal artery. So see, this is the axillary artery, right? This is the axillary artery, and the first part of axillary artery, uh, we are getting one branch, as we know. This is the first one is superior thoracic artery. From the second part of the axillary artery, we are getting two branches, the acromiothoracic artery and the lateral thoracic artery. So axillary artery, actually the first part and the second part of the axillary artery supplying the breast. Okay, total three branches of axillary artery: superior thoracic artery, acromiothoracic artery, and lateral thoracic artery. Okay, then we have the intercostal artery. These are the perforating branches. Branches of internal thoracic artery is also supplying the breast. And we have this posterior intercostal artery which are also supplying breast. So this was about the blood supply of the breast. The breast is actually supplied by the anterior and lateral cutaneous branches of fourth to sixth intercostal nerve. We are going to learn about this intercostal nerve in thorax, but the breast is actually supplied by the anterior and lateral cutaneous branches of fourth and sixth intercostal nerve. Okay, and they will actually carry pain fibers, right? And they will also carry some somatic fibers to the muscle, but the lactation is controlled by the prolactin. So gland is uh, actually supplied by this fourth to sixth intercostal nerve, but the lactation is controlled by anterior pituitary, the prolactin hormone. Now we are going to discuss about the lymphatic drainage. So lymphatic drainage of this gland is very much important because carcinoma of breast is spreaded through the lymphatic, right? There are actually three main lymph nodes which are draining the mammary gland. That is the axillary lymph node, the internal thoracic lymph node, and posterior intercostal lymph node. The main lymph node for a mammary gland is axillary lymph node, which is draining about 75% of the gland. The 20% of the gland is drained by internal thoracic lymph node, and remaining 5% by the posterior intercostal lymph node. So see, this is the axillary lymph node. Axillary lymph node has too many parts, right? We can see this is the apical part of the axillary lymph node. This is the central part of axillary lymph node. This is the anterior part of axillary lymph node. This is the posterior part, and this is the lateral part of axillary lymph node, right? Apical, anterior, posterior, lateral, and central part of axillary lymph node. We can also test this is the posterior intercostal lymph node, and then we can see this is the internal thoracic lymph node, right? Lastly, it is drained by the supraclavicular lymph node. So supraclavicular lymph node is the last lymph node from which all the lymphatics will pass through. Beneath the areola, there is superficial lymphatics which are aggregating and forming a subareolar plexus of Sappi. Okay, and we have one more lymph node, that is the subperitoneal lymph node. Now, one thing to notice, so this is the lower medial quadrant of the gland, which is also draining into the subperitoneal lymph node. And one thing more to notice that this is the breast, right? The its medial quadrants are also draining to the opposite side, internal thoracic lymph node. Okay? So this was about the lymphatic drainage of gland. So now we are going to discuss about the clinical anatomy of the breast. Carcinoma of the breast is very common nowadays, right? So uh, what are the symptoms we are seeing in a carcinoma of breast? Right, we can see the retraction of the skin of the breast, right? Why there is retraction of the skin of the breast? It is due to infiltration of the suspensory ligament of the Cooper by the cancer cells. So when the cancer cells are infiltrating the suspensory ligament of Cooper, there will be retraction of the skin. Then we can see the retraction of nipple sometimes. So it is due to the infiltration and fibrosis of the lactiferous duct, right? So due to infiltration of the cancer cell into the lactiferous duct will produce retraction in nipple, right? Sometimes we can also see edema of the superficial lymphatics due to cancer cells, right? There will be edema and of the superficial lymphatics, and the skin over the gland will become somehow orange, and this sign is known as pudgy orange appearance of the gland. So when there is pudgy orange appearance of the gland, it can be due to edema of the superficial lymphatics. It is the sign of a tumor, right? So okay, so how can we prevent this condition? So the person should self-examine her gland, right? Like checking the symmetry of the gland, checking is there any retraction of the skin, nipples, or any color change in the gland, uh, by palpating the lymph node, right? These are the steps we can follow in the self-examination of the gland. So now let's see the spread of the cancer. So as we know, the breast is actually drained by three lymph nodes: axillary lymph node, internal thoracic lymph node, and posterior intercostal lymph node. But as I mentioned earlier, the lower medial quadrant is draining into the subperitoneal lymph node. So the tumor from the lower medial compartment can also spread to the peritoneal cavity. It can also spread to the abdomen or pelvis. So then sometimes some women have also the cancer of ovary due to the cancer of breast. The cancer of breast is actually metastated to the ovary. So this kind of tumor is known as Krukenberg's tumor. Okay. So, as I also mentioned earlier, that uh, the medial compartments are also draining to the another side. So cancer can spread to the bilateral side. It can also spread to the abdomen. It can form the Krukenberg's tumor, and uh, it is also connected with the veins of the vertebral column, so it can also spread to the vertebral column, right? And so, what is the treatment of this carcinoma of breast? We can do lumpectomy, right? So, what is lumpectomy? Actually, we are just removing some lobe of mammary gland. That is lumpectomy. Mastectomy is a surgical term used for uh, surgical removal of the gland. Is known as mastectomy. So, surgical removal of gland is known as mastectomy. The mastectomy can be radical or it can be modified radical. So what is radical mastectomy? We are actually removing the whole mammary gland along with the pectoralis major muscle and also the all lymph nodes we are removing. So that is known as radical mastectomy. And in modified radical mastectomy, we are actually removing the lymph node and the gland. So the pectoralis major muscle is not removed in modified radical mastectomy, right? And some women also can do implanting. What we have discussed in mammary gland, we discussed the situation, its accent, its deep relation, its structure. In structure, we see the skin, parenchyma, and stroma of the gland. Then we discuss about the blood supply, nerve supply, and lymphatic drainage. Lymphatic drainage is very important because carcinoma of breast is spreading through this lymphatics only. Then we also talked about the clinical anatomy. So if you like the video, please like the video, subscribe to this channel, and also share it with your friends. Thank you so much.